They have chosen not to collaborate with the minority and make a true bipartisan package. This is not bipartisan. For bipartisanship to work, the majority has to be willing to collaborate with the minority. That has not occurred.
The ayes are 217, the nays are 213. The bill is passed, and without objection, the motion to reconsider is laid upon the table.
Hello, everyone, and welcome to Commoners Podcast. Today, we're going to be discussing the American Health Care Act, which was passed last week on Thursday. Passed the House of Representatives by a vote of 217 to 213. It wasn't the episode that we originally planned on. We were thinking we were going in a completely different direction, but this came up, so we figured we'd change our agenda. But first, Adam, how you doing?
Yeah, doing well. We actually have an election day here, and it's not the big one that you would think of. We've got 4 different levels of elected government here, and this is the local election day, so it's not the most exciting, but, depending on how you value people taking out your bins and, schools, so small things like that. So
it's like a township sort of election, not a municipality?
Yeah, it is kind of more municipal, I guess, but it's not as big as your state, let's put it that way.
Okay. Like a town.
But we've been to the polls 7 times in the last 3 years because of this stuff. So there is such a thing as voter fatigue.
Yeah, I can imagine. I'll admit I'm not super involved in my local elections. I probably should be, but to me, it doesn't make all that much difference. I do vote for state level reps to go to the state Congress, but when it comes to mayor stuff like that, doesn't tend to make that much of a difference.
No, the colour of park railings and the colour of the bins, they don't, hit a deep core of social involvement, social need.
Yeah. Speaking of social needs, healthcare. As we mentioned, the Republicans single-handedly, essentially, passed the American Health Care Act last week. Only Republicans voted for it. Every single Democrat who voted nay. The Republicans, it was a slim vote, slim majority, only 217 to 213, and the Republicans really could only lose 23 votes, or they could only lose 22 votes and still pass it, and they lost 20. So there were 20 defectors, and it was razor thin margin.
So
really,
close.
really close. Very, very close. It's weird to say, but if you're politically involved, hey, call your reps if they voted against it and say thank you. Thank you that you voted against it. We definitely did not support this bill. I think the bill, last I checked, it had a 17% approval rating, according to a Quinnipiac poll.
And it just seemed worse than the bill that was initially put to the, in fact, not even put to the floor. So I can't imagine that it's gained any approval in the public opinion either.
The first iteration of the bill didn't even make it to a vote. There was some debate on it, but it didn't make it to a vote, and it was pulled by Paul Ryan. And at the time, we thought it was a massive defeat for Trump. And I guess, when a Republican bill is put forward, the sort of litmus test that I have for how bad it is, how much it screws small people or the little people, how much it screws people who don't make a lot of money and low-income people, is how much support it gains from the Freedom Caucus. If the Freedom Caucus doesn't support a Republican bill, then you know it's bad, because it means that they want to go even further to the right on things. So if the Republican caucus supports it, you don't want anything to do with it.
And so the Freedom Caucus were actually brought on side with this iteration.
They were. So essentially what happened is the first bill came out, and I talked about this in Political Animals, where the Freedom Caucus has a track record. This is basically the Tea Party in the House, and what they do is a lot of times they scuttle Republican legislation or even Democratic legislation because it's too far to the left. It's not right wing enough. So like when Obama came out with his grand bargain and he wanted to defund several entitlement programs, right? It would be at what Obama put forward would have been a massive cut. Like, it was a big time compromise, like more than a compromise. It was just a bad move for the Democrats to make. And the Freedom Caucus voted against it. And they're the ones who actually stopped it from happening because it didn't go far enough. So we actually got saved from those massive cuts that Obama was going to do by the Freedom Caucus. And so they have a track record of doing this by being so extreme and not compromising at all. They actually sometimes it works out for the left and the liberals, but not in this case. So the first iteration of the bill didn't go far enough. They were worried about the first iteration of the American healthcare bill. They wanted nothing to do with it because it didn't go far enough in pulling apart Obamacare. And I guess we'll get into the nitty gritty of what that entails. But I guess before we dive into the bill itself and what we're stuck with now, or at least what we could potentially be stuck with if it passes the Senate, before we dive into that, I thought it would be good to have a discussion about the role of the state in healthcare. And we're both liberals, we're both progressive liberals. And so you and I, in one form or another, support a single-payer healthcare system. I have my own reasons for it, you have your own reasons for it. You actually live in a single-payer healthcare system that does pretty well. So what are your reasons? Why do you think the state is obligated to supply healthcare paid through taxes?
Sure. So as you just said there, the single-payer health system, unlike what is currently Obamacare, is a system that means that insurance is provided through the state, through essentially tax payments. Now, many countries in the West, in particular the developed world, would run a type of single-payer system. The most pure form of a single-payer system is actually in Canada. Because I'll kind of get to the details of the UK system in a second, but Canada is you pay into the state, and the state then covers the costs of your private healthcare. So you go to a GP, as you would, and then the GP essentially writes a bill and forwards that to the state, and it's the state that pays through, taxed income. So when it actually comes to the philosophy of healthcare, I quite like to think of it in terms of human rights. So when we look to the past and we look to the future and we see the development of technology, what we've considered human rights has kind of developed along with it. So back when, way back when the state was first kind of becoming a thing, the state had no obligation to provide clean water, for instance. Now it's a necessity. There's no good or well-functioning state that doesn't provide clean water for its people. As technology continues, now we're kind of in healthcare. It's like, is healthcare something that should be provided by the state because of the technological advancements that we have, because of the ability that we now have, both technologically and in terms of our nation's wealth, to provide it? And I guess that's kind of where we're stuck. So most countries in the developed world have adopted a position of, yes, of course we should. We should be able to provide healthcare because we have the ability, both technologically and financially. But there are some that are obviously still debating it a little bit. And of course, in the future, we'll be having this discussion about internet access. Countries like France and Greece constitutionally guarantee the right to internet access. And so I think we'll kind of see those debates over what is a necessary human right in terms of technology and human advancement. The question will be what will be necessary, what will be an innate right of humanity.
On top of that, what will be part of the debate more and more, and it's even gaining support now, is something like a universal basic income. And to your point about technology, where burger flipping jobs and drive-through window jobs, those are going to be almost completely automated in the future. And as you automate jobs, as jobs leave the market, you're going to have to supply some sort of basic income for people to even survive. Otherwise, you're going to have massive amounts of inequality that just will be institutionalized at that point.
Right, and so many people will disagree with me on this, and I can understand especially the Freedom Caucus position of, we don't want the government to meddle in our healthcare. The market can take care of it. One, I disagree. The market sucks at doing healthcare. It sucks at education. Like, profit-based motives don't do any good in these types of environments. But as you were just saying there, in terms of equality, I think that for me, I think that is the primary purpose of the government, is to provide justice. It's to make sure that everyone is equal under the law, that everyone has the same access to opportunity. And I think, again, given our nation's, respective nations' current advancements, then healthcare is one of those things that just has to be done by the state, because market isn't going to do it for us.
I would absolutely agree with you that the market is terrible with health insurance. And you can just look at the history of the United States. We had millions upon millions of people who weren't covered under the system before Obamacare, simply because the free market, if it's looking at insurance, the idea of insuring somebody is you're basically having them pay you for the risk of them having some sort of health problem. Now, if you have pre-existing conditions, like if you have a genetic predisposition to any sort of disease, back then, an insurance company could literally say, no, we're not going to insure you. Or if you were insured, it was through something like a high-risk pool where the premiums were very, very high. They were going up at 6 to 7% per year. And that wasn't stopping. The cost was inflating like crazy. And so essentially what happens there is people are priced out of the market. So if you have a bad enough pre-existing condition, you're priced out of the market. If you have asthma, okay, yeah, your inhaler doesn't cost as much as chemo treatments. If you have cancer, your premiums are going to be so high that you're not going to be able to pay for insurance. And then once you lose the insurance, I mean, you heard stories all the time of people having to mortgage their houses and lose their houses to pay for healthcare. And if you're a parent and you have cancer, you have to look at it and say, wow, am I going to really mortgage my child's future for my life? And you're in a situation where you have to take into account that calculus. So when there's not coverage for pre-existing conditions, while there were high-risk pools, and high-risk pools will still exist under the American Health Care Act that was just passed, the pre-existing conditions are covered in name only. Yes, technically, insurance companies won't say no to you for pre-existing conditions, but potentially they'll be able to charge you whatever they want. And we'll get into the details of that in a minute. But the free market just hasn't given the results that we think it would. I mean, especially in healthcare. If you look at it in any other industry, technology, advances in technology drive the cost down. In medical science, in healthcare, advances in technology drive the cost up.
Yeah.
So an MRI machine, getting an MRI is going to cost you way more. If you have an incredibly efficient diagnostic machine for your car, it's going to cost way less for you to have your car checked out rather than have a mechanic under the hood looking at your emissions, right? So technology in other industries makes the price go down. In healthcare, it's really strange where you have increases in technology actually make it cost more. So the market forces just haven't controlled the cost of healthcare. On top of that, there is a fundamental idea in the United States that we are equal. Now, that doesn't mean equality of outcomes. I wouldn't be a Marxist or a Trotskyist or anybody who believes in equal outcomes. But I agree certainly with equal opportunity. And when we had, before the Affordable Care Act, 60% of bankruptcy cases, 60% were due to medical expenses. That's just not something that happens in any other country.
Yeah, that is incredible.
So in my opinion, without some sort of single-payer system, you can't really have equality of opportunity, because at any moment, my child could come down with a terrible disease, and if I'm not insured, then essentially, too bad for me. Too bad for my child if I can't afford it, which I certainly wouldn't be able to. And you talk about equality. I watched the debates prior to the vote, and many of them quoted Dr. Martin Luther King Jr. I don't have the quote right in front of me, but he said that of all of the inequalities, the most unjust or the most egregious that he could find was inequality of healthcare, or the unavailability of healthcare, because you're dealing literally with your life. It's a life or death thing, and you're denying somebody the right to life potentially because they don't have enough money. And not only that, single payer systems operate much more efficiently than we do in the United States and get better results.
Yes, they do.
And you can speak to that from the UK system.
Well, yeah, I was going to say that I think the percentage GDP spent in the US is somewhere around 17%, whereas
17.6% in 2014. Yeah.
Whereas in the UK it is around 9%. Now I know that the UK also spends much more on care, particularly preventative care that isn't in that 9%. But at the same time, that includes kind of old age in-home care. Like there's a vast number of employees within that system that just go into increasing the quality of life of the elderly, for instance, whereas I don't believe that that's necessarily the case. I know you've got Medicare in the States, but even that is not in-home care in the same sense.
Right. And the thing is, too, there's a lot of eligibility issues with Medicare, and if you have estates or if you have a house, you have to really hurry up and sell it or put it in a trust way ahead of time so that you're prepared for when you need the help. Otherwise, they'll take literally all of your assets. And even then, the cost of healthcare skyrockets after a certain age. And we'll see through this bill, it's going to get even worse. It's going to get way worse. People talk about the GDP, and you look at the GDP and you say, okay, yeah, but America's such a larger country and, quality of care and all that, but we don't get better results. If you look at comparisons among OECD countries, we're average.
Well, and I think you could technically make the argument that, you could get better healthcare in the States. I think that might be true. For instance, you could, the specialists in a variety of medical fields are in the States. We would have our own specialists here, but the US has a fairly incredible system. The problem is that it's inaccessible for someone like me, for someone who is working, a relatively uninteresting job for an uninteresting wage for, small family, large expenses. That is just not accessible. Whereas here in the UK, it's free at the point of service because of the way that the system is set up. So we've used the healthcare system, the NHS, the National Health Service, many times since moving back here. Obviously, we've had a son here as well. And that entire period through, the prenatal counselling, prenatal care through the birth itself, and the postnatal care was all on the NHS. So it is advantageous for, folks like us who are just kind of in the middle, living kind of uninteresting financial lives.
Yeah.
Whereas that's quite difficult in the States. I know that having children in the States can be very expensive.
Yeah, and well, believe me, it is very expensive. I'm still paying off both my daughters. And one of them is 4 and one of them is 2. so I maxed out my insurance on them. So I pay my deductibles and I max out my out-of-pocket expense, and then they pay the rest. But it's just to show you how expensive it is. We didn't even go to a top-tier hospital. And so you have the birth. I pay, anywhere between $6,000 to $8,000 worth of premiums, just out-of-pocket per year premiums. And then I have, on top of that, a $5,000 to $6,000 deductible that I have to pay before the insurance kicks in. And then after that, then they pay everything. But, my kids, and I didn't have both my kids in 1 year, so both my kids cost me about $5,000 each just to have them. So, we're paying that out of the pocket. So that becomes billed, and that's a monthly expense now.
Well, and I think that's kind of the big problem with the States in particular, with the healthcare system. Was that even under Obamacare that you had your kids? Yeah,
even under Obamacare. But my case is slightly different because I didn't buy through an exchange. I have insurance from my employer. But even then, what Obamacare did, and we can get into this later, we'll get into the specifics later, but what Obamacare did was essentially every plan had to cover a minimum 10 essential benefits, which did raise the cost of plans. But at the same time, you're paying more, but then you're getting better benefits, which is, I guess, the idea. I think, a lot of the Republican argument that I laugh at is, choice. Well, okay, fine, but you're paying money out of your pocket, and then when you actually need insurance, it's not going to actually cover anything that you need covered. So why would you want to make that choice? Why would you want to make the choice to have shitty health insurance? But, some people, whatever, maybe they might want to.
It is the middling people, the folks in the middle that are hurt the most by, US healthcare law, and I don't see this new bill going anywhere to actually fixing it either. Again, if anything, it looks as if it's getting worse.
Yes, it's definitely getting worse. And the silver lining, I guess, though, is that it's very unlikely that it's going to pass Senate without some serious changes. Senate Republicans are not a big fan of the bill, although since it was passed, a form of it is likely to get through the Senate, but it might not be as extreme. We'll just have to monitor it. But as is right now, it's a horrendous bill. And just one last point before we move on to the actual act and what it entails. The big thing in the United States, or the argument against single payer, is that, all these taxes are going to go towards it and all of this stuff. We spend, like we said, 17.6% in and around there of our GDP, but hard tax dollars that the government spends per capita, we actually spend per capita, just hard dollar amount, more than most other countries that offer universal healthcare. So, for instance, Sweden pays, I think it was like $4,300, give or take, last time I checked I think this was done in 2012, per capita, whereas we pay just about $4,500 per capita, and that was a few years ago. Now the expense per capita is over $10,000 in the United States.
Whoa,
But that's a mix of private versus public. So we are putting a crap ton of tax money towards our health system already, and we're not nearly getting the results that we should. Middling to average results at best. So yeah, maybe you could have better care in the United States, but your chances of having better outcomes are small. And the other issue is that for the pricing at least, is that there are no real cost controls in the United States. I know that in single-payer systems like in France and Canada and the UK, the government actually negotiates on behalf of the insured population these prices that can be charged through, billing the NHS, correct?
Not so much, I think, in the UK, because there's no such thing necessarily as health insurance in the UK, which is why it technically isn't single-payer. That's kind of the nuanced detail. So when you look at Canada, yes, definitely. But when it comes to the UK, the entire health infrastructure, minus a few private practices, is owned by the state. It's entirely public. And so you pay into the public system to then access a public system.
I think is some of the problem, especially with like drug prices. And actually, the Senate has voted against, and actually I think it was in California where they voted against being able to negotiate drug prices, just like the VA does. The VA negotiates drug prices.
Right, okay.
But there is no negotiation power, and if you have a large population, collective bargaining is the way to get things done.
So yes, you're right. Especially in terms of pharmaceuticals and even things like prosthetics and medical equipment, yes. The entire NHS can bulk buy at such ridiculously low rates that keeps the cost well down. So yes, there are advantages to having these massive markets.
I mean, you go to a hospital and you look at your itemized bill, a box of tissues is like $50. And I saw a case once where it was literally listed on the listed on the invoice as a paper cough suppressant, and they're charging you $50 for a box of tissue, like a little pack of tissues, like those little travel size ones.
Yep.
And they're charging you for everything. Like a hip replacement in the United States costs like $40,000. You can get one in Spain or France for like $13,000, and you don't see a bunch of cripples hobbling around on bad hip replacements in France. Like the outcomes are not drastically different, but the costs are very, they're not even comparable. They're not even the same, order of magnitude. So it's just insane. And this bill is not going to help that at all. And we can get into that now if you want.
Yeah, I was going to say, let's bring on the detail.
Okay, the details. The nitty gritty. Forgive me, I'm probably going to go on quite long here because I do have a lot of notes, but it's just so complicated. So as we said earlier, the original bill, the American Health Care Act, which was, I think it was introduced in March, it did not have the support of the Freedom Caucus, and as such, it flamed out. It didn't even get to a vote. So we've discussed this. The Freedom Caucus didn't think that the bill was really conservative enough. It didn't give enough latitude to the states to determine what they wanted to do, and they thought that Obamacare was an overreach of the federal government. The Congressional Budget Office, which is a nonpartisan group that scores legislation as to the effect it's going to have, what the long-term cost of a bill are going to be, their original estimate was that the bill would reduce the deficit over 10 years by $337 billion. So Republicans were all on for that because they call themselves deficit hawks, even though in the past they haven't been great with deficits. But the other shoe to drop was, of course, 24 million people by 2026 were going to lose insurance. So yeah, you have a savings on the front end, or the back end, I should say, of $337 billion, but 24 million people are losing insurance. So then there were some tweaks because moderates and the Freedom Caucus really couldn't support the bill. Moderates thought that it might have gone too far and was taking too many protections away from their constituents, and they wanted to get reelected. So there were some tweaks. The CBO scored a bill again later on in March, found that the same amount of people were going to lose their health insurance, 24 million, but it cut the deficit savings in half, give or take. So the deficit savings would fall to 150 billion through 2026. So same amount of people would lose insurance, and you're spending about $170 million more, or $187 billion more. So at that point, the bill was sort of pushed through to Congress. Paul Ryan was really pushing for a vote. Trump was really pushing for a vote because they wanted something to tack into his 100 days and say that he was successful. But the bill died. It didn't even make it to a vote because the Freedom Caucus just would not change their mind. So things began to stir in the end of April, where there were meetings between the Freedom Caucus and the White House and amendments that could go into this bill. And there were a couple amendments, 2 amendments, in fact, that one brought on the support of the Freedom Caucus, and then the other sort of sweetened the pot for moderates who were upset about the amendment that was bringing on the Freedom Caucus. Because, believe it or not, a lot of moderate Republicans cannot stand the Freedom Caucus. The first amendment that was done to woo the Freedom Caucus is the MacArthur Amendment, put forward by Representative Tom MacArthur. And it made 3 big changes to the bill. Originally, what it was is that the bill was more or less going to keep the 10 essential benefits. It was going to keep the coverage for pre-existing conditions and children to be on their parents' insurance and things like that. But this amendment sort of changed that. So, firstly, the 10 essential benefits that were in Obamacare, and we'll just go through those. So these were 10 essential benefits that were covered through the Affordable Care Act or Obamacare. Outpatient care, which that's getting care through your primary care physician. It's what you get without having to go to a hospital. So, like a casting or something in your doctor's office, stuff like that. Trips to the emergency room. So if you fall, shoot yourself, whatever, you break a bone and you need to go into the emergency room, that is guaranteed to be covered. Treatment in the hospital for inpatient care. So if you're admitted to a hospital, that has to be covered by your health insurance. Care before and after a baby is born. So pre and postnatal care, just makes sense. Mental health and substance abuse services. So this would include, behavioral health treatment, psychotherapy, counseling, stuff like that. Prescription drugs. Services and devices to help you recover from injury, crutches, wheelchairs, things like that. Or if you have a disability or chronic illness, so if you had, kidney problems, the dialysis machine would be covered, stuff like that. Any lab tests, so blood work, urine samples, stuff like that. Preventative services, including counseling, screenings, and vaccines to actually keep people healthy. Those were supposed to be covered as well. And then pediatric services, which include dental care for your children and vision care for your children. So that you wouldn't have to get a separate dental or vision care plan. You just have to have your insurance plan, and that would cover your kids at least. And if you wanted care for your dental or your vision, you could buy a plan. So essentially what the amendment did was it took those 10 essential benefits, and even though it doesn't strip them, it does give the states the ability to apply for waivers. So essentially what that means is you better damn well hope you live in the right state.
I don't know if you necessarily know the answer to this, but what states would be more inclined to... Because some of the most Republican states, for instance, are also some of the poorest states in the country. So could they... In other words, would any state in their right mind actually apply for these types of waivers?
I could see some places like Kansas or Texas doing it. Definitely red states. I don't think a single blue state would. I live in Massachusetts. Now, before Obamacare was put into place, we had Romney Care. So
that's right.
These sort of things I don't have to worry about. And I'm fortunate in that regard. I don't live in a state where I have to worry about this happening. But there are many states, I can't think of one off the top of my head, but there were, I think it was 30 or 35 states that accepted the Medicaid expansion in Obamacare, which we'll get to later. But the states that didn't accept it, I could definitely see wanting to get out because they weren't really buying into Obamacare in the first place. So the state will be able to set whatever regulations it wants. So if it waives itself from these requirements, then, if you live in that state and you're having a baby, it's very, very, very likely or very possible. I won't go as far as to say likely, but it could be that you're not covered. Pre- and postnatal care is not covered. And any manner of things are not covered, which, it will bring your costs down, but it will bring the cost of your insurance down. It's not going to bring the cost of your care down. If you're not insured for these things and they happen to you, you're going to have to pay for them out of pocket.
Right.
The second thing that the MacArthur Amendment got rid of, or let states have a waiver option on, was community rating. So what this is, it's a fancy insurance terminology for not being able to charge people with pre-existing conditions in the same age bracket in the same area more. So if I have a predisposition to a certain disease and me and my neighbor are the same age, an insurance company wouldn't be able to charge me more than my neighbor. So that's going to raise premiums a little bit, but it's also going to make health insurance more available to people with pre-existing conditions and have them not have to go into two high-risk pools. So, and obviously, if you have a lot of people buying health insurance, then that's going to mitigate some of the costs, which is the logic behind the really controversial individual mandate, which is essentially you have to buy insurance. The government was mandating that you had to buy it, because if everybody were to buy it, then that offsets the cost. But what this amendment does is it will allow the states to take a waiver from that. So that would basically, it would then require the state to set up a high-risk pool, which is a separate insurance pool for people with pre-existing conditions. Those tend to be much more expensive. The costs tend to rise much faster than other insurance pools. And they just have not gotten great results in the past. So if you have a pre-existing condition, it's very likely if you live in one of these states, your premiums are going to go way up, because you're going to have to be either paying more to be in these high-risk pools, or you will be priced out of the market, depending on how much your costs are. And the third thing it did was it gets rid of the age rating. So people, I think, over 50 now, if an insurance company wants to charge people over 50 more, they'll be able to do that. For Obamacare, or the Affordable Care Act, it limited that ratio to 3-to-1. So if you wanted to charge somebody more who was older, you could only charge them 3 times as much as somebody who's younger. The original bill, the original American Healthcare Bill, changed this ratio to 5-to-1. So now somebody over 50 could potentially have to be paying 5 times as much as somebody my age. But this amendment lets the state have a waiver for that, so they could set the ratio to whatever they wanted. So they could not even put a requirement in for the ratio. So an insurance company could be charging somebody 20, 30 times as much. And if they have a pre-existing condition and they're older, then they're really screwed, because essentially they're going to be able to charge them whatever they want.
So I'm beginning to wonder about, Republicans and their natural voters, because in general, older folk tend to vote Republican, but this seems to be really at a disadvantage, at least between the 50 and 65-year-olds. So 65-year-olds gone to Medicare, well, at least I assume most of them. But I mean, that is a big group.
It's a kick in the teeth. It really is. And unfortunately, a lot of people just don't realize it, and they won't realize it until it starts affecting their wallet.
But what's the political strategy here for the Republicans?
The political strategy is that over 7 years, they've demonized Obamacare. So now people will just be so happy that Obamacare was repealed that they're not really... I mean, it is a politically toxic thing. I don't understand how any Republican could have voted for this, because it is incredibly unpopular. We were talking about it earlier. The latest Quinnipiac poll was polling about 17%.
That's right.
And that was before these amendments, which made it even worse. So it doesn't make sense. And I think the problem is a lot of these people were duped into Trump's rhetoric about populism and saying, and Trump has even argued for single payer in the past, like 5 or 6 times.
Yes.
He's argued for it. And this is the healthcare bill that he puts his name to. It's just unconscionable. It doesn't make any sense, and it's going to hurt people who need help the most. So to sort of offset the cost, the assumed increase in cost for people who are older, there's now going to be, they're getting rid of tax subsidies. So your subsidies are going to go away if you're trying to buy private health insurance. But there's going to be tax credits based on your age. So somebody my age, under 30, would be getting about $2,000 per year to help pay their premiums. And it goes on up an age-weighted scale to your 50, and I think it maxes out at $4,000. which if you understand the healthcare costs in the United States, $4,000 is a pittance compared to what you're going to be paying, especially if you're allowed to. I mean, my premiums right now are between $6,000 and $7,000. If you're allowed to charge 5 times my premiums to somebody who's 50, a $30,000 premium, are you kidding me? And a $4,000 tax credit tax credit is supposed to alleviate the cost enough to make that affordable. I just don't see it happening. So then with these amendments that sort of brought on the support of the Freedom Caucus, moderate Republicans sort of maybe grew a conscience and saw that this was going to really hurt a lot of people. And there was some negotiating that went on, and then finally they settled on the Upton Amendment, which was introduced by Fred Upton. And we talked about those high-risk pools that do receive federal funding. So the Upton Amendment, essentially what it does is it allocates an additional $8 billion of federal funding to high-risk pools in the states. And this is added to the already $130 billion that was in the original bill, so now the total is at $138. But the problem is many think tanks have come out and talked about this. The CBO hasn't had a chance to grade this yet or do a score on it. But a lot of independent organizations that do policy reviews and predict what policies are going to do came out and said that this is it's a pittance. It's not going to do nearly anything to help high-risk pools. So, for instance, the Center for American Progress estimates that the extra $8 billion in the Upton Amendment would only cover about 76,000 more people, which is really not that many when you consider that estimates of people who could be considered to have a pre-existing condition are as high as 130 million.
I question that number a little bit. 130 million is a full third of the country. It just seems ridiculously high.
But the spectrum of things that people can be considered to have pre-existing conditions for is incredibly large. So, for instance, if you had, in your medical history, if you had taken antidepressants at any time, you could be considered to have a pre-existing condition.
And so they'll be that narrow in their kind of siphoning through your medical history.
Oh, yeah. It really beggars belief, some of the things that could be considered pre-existing conditions prior to the Affordable Care Act in normal underwriting procedures. So things like eating disorders, depression, anxiety, heartburn, pregnancy. And I'm assuming we're going to go back to those defaults now with the American Health Care Act. There's no reason to think that it won't in states that opt to have high-risk pools. There are cases before the Affordable Care Act where being a victim of domestic violence in the past, having a C-section, postpartum depression, even rape were considered pre-existing conditions. Just think about how perverse the incentive is there. It could literally incentivize a woman not to report a rape or domestic assault out of fear that her health insurance premiums could go up if she's not in a state that protects these things. So this bill is just horrendous. Now, you are protected against some of this when you're talking about employer insurance. But if you're looking at employer insurance that's sponsored through your employer, a lot of times it's group insurance, so you get to go in even if you have a pre-existing condition most of the time. For instance, for my insurance through my company, it's expensive, but it's not as expensive as if I were to go on the individual market. But if you try to go through the individual marketplace, there are pages and pages of questionnaires that you have to fill out. Have you ever smoked? Have you ever done drugs? Have you ever, how many times do you drink alcohol per week? Things like that. And so you have to fill all that out, and that is the actuarial calculation figures out what your risk is, and then they give you a premium. Even with that amendment, only about 700,000 people with pre-existing conditions in high-risk pools would be covered, which is not going to be enough. Estimates are that's actually off by a factor of about $200 billion at least. So, so that's kind of giving you an idea of how underfunded that this is. And given that they want to save money from what they would be paying in Obamacare, they don't want to be spending any extra money. So this small amount of money, this $8 billion, that actually pulled on some moderates. And that's essentially what allowed the bill to pass. There were two holdouts that flipped from no to yes. I forget their names. I think it might even just be MacArthur and Upton. But they flipped. There was, I think, 19 people, or no, there were 21 people in opposition, which only gave them one vote margin of error. and those two flipped, which gave them only 19 against, and then they felt confident enough, the whips felt confident enough to go forward. Ultimately, 20 Republicans voted against it, but the bill passed through. But other aspects of the bill that really weren't changed, that were part of the original, that are still just egregious. As far as Medicaid, I don't know how much you know about this, Adam. Medicaid is essentially, it's a means-tested government insurance program for low-income Americans. So if you make below the poverty line, essentially, or you were kind of eligible for this subsidized government insurance program so that you could get health insurance. What the Affordable Care Act did was it expanded Medicaid and federal funding to Medicaid to cover people making 133% of the poverty line. The poverty line for a four-person family is $24,250. So roughly, if you made $32,000, you were eligible for the Medicaid expansion up to $32,000. What the Republican healthcare bill, it essentially allows that Medicaid expansion to continue to 2020, but then it just cuts it off. So the funding is going to go away. I think it's $880 billion where the funding is going to be taken away from Medicaid, and then it's going to go to a funding that's going to be capped. Well, essentially, it's going to be the funding is going to be capped on a per person basis. I don't know what that cap's going to be, but essentially after 2020, that's just going to go away. To put it into perspective, I think it was 50% of the people who gained insurance through Obamacare gained it because of the Medicaid expansion.
Wow.
Yeah. So you're stripping a lot of people off insurance, and that's going to be just a drop dead date in 2020 where that just is stripped away.
And of course, it's your lower rung as well that are making just barely over the poverty line that are getting their Medicaid cut right out from under them.
Yep, essentially. Yep. So one of the big things about Obamacare was the individual mandate, and so that was considered coercive by the Republicans, and they didn't want every government requirement. So what they replaced that with in this bill is an allowance for insurers to mark up your premiums by 30% if you have a lapse in coverage. So the incentive is going to be on you to continue insurance coverage, because if you have more than 2 months of a lapse of coverage, then next time you buy it, it's going to be 30% more. Just as an aside, though, I don't see that as an incentive at all. Because here's the thing. If I am healthy right now, right, and I get cancer, God forbid, the pre-existing conditions is not, the coverage for pre-existing conditions is not going away. It's going to be more expensive because I'll be in like a high-risk pool, or if a state opts out of it. But if my state doesn't opt out of it, my pre-existing condition is still covered. I would rather pay 30% more on my premiums than have to pay millions for my cancer treatments. So if something really bad happens, it's better on me to buy the insurance when I actually need it rather than paying it up front now.
Well, and actually, to be honest, the thing that mostly annoys me about this is it reminds me of like my cell phone bill. Like purchasing a cell phone plan. It's like you, at the end of your 12-month contract, you know that your bill is going to go up by 30% because, hey, you bought the 12-month deal.
Yeah,
that type
exactly.
of thing. It just reeks of market capitalism within the healthcare system. Really annoys me.
Yeah, it's terrible.
It just absolutely annoys me. Because then it's almost consumer manipulation in a sense. It's base.
Yeah.
It annoys the heck out of me.
Nobody agrees with you more than me. The bill would also abolish most Obamacare taxes, including medical devices, health insurance premiums, indoor tanning salons, prescription medications, and high-cost employer-provided insurance known as Cadillac plans. So it's stripping a crap ton of taxes. There were a bunch of taxes, too, that were on families. I think it was over $259,000 who made income by investments. Those taxes are being taken away. So essentially, the taxes that are coming off the top, when I was looking at it, I think it's like the top 2% of earners in the country are going to get these tax deductions. So it's not going to... This is more like a tax bill than a healthcare bill.
I mean, which makes sense anyway, because the original, even Obamacare, is ultimately a tax bill. It wasn't really a healthcare bill. I mean, I don't know if it's the best place to go on this tangent, but I hated Obamacare to begin with. It's a reform of insurance laws. All right, it was not a healthcare bill, and And now what you've got is essentially just the Republicans coming in and tweaking the details of the tax details. The Obamacare was terrible from my perspective, although I recognize that it certainly was a step up from the system before. But this is just tweaking and murkying, and it's hardly a decent successor.
I totally agree with you. And what makes it worse, and to your point, is that this is not a liberal position, and it's poisoned the liberal approach to healthcare. So essentially, people look at it and say, "Oh, well, that was the liberal position. Let's try the Republicans because Obamacare is imploding on itself and the premiums are so high and all of this stuff," which is true to an extent. Obamacare has made costs go up. But the thing is, the individual mandate system with the subsidies was introduced in 1974 by Richard Nixon. It was championed by places like the Heritage Foundation in the early 90s when they tried to do single payer. The Clintons, quote unquote, tried to do single payer. Newt Gingrich, Chuck Grassley backed this exact sort of plan. Romneycare, Mitt Romney, a Republican, implemented almost this exact sort of system in Massachusetts. It was actually the framework for Obamacare. And why Obama went with this framework was because he wanted to garner Republican votes. So at first, they didn't really even try for a single-payer system, even though they massively controlled the Congress. Both the Senate and the House were Obama's. He could have put it through if he really had the political will to do it. But they even dropped the public option. And because they wanted to garner Republican votes. And then they went with Obamacare, which was a watered-down version, a neoconservative bill at best, and no Republicans voted for it. So you went through all that trouble to get Republican votes, and they didn't even do it. No Democrats voted for this bill, but the Republicans still pushed it through. Where is the political will in the Democratic Party to do the things that they know they should be doing? Right? Like, where is the political will? Like, there was support for a single-payer option. Obama was unbelievably popular when he was first elected. He could have done whatever the hell he wanted, and he chose not to. Because the American political system forces people to govern from the center, or it makes them believe that they need to govern from the center.
And I guess he was more of an idealist back in his early tenure, thinking that perhaps it was time to bridge the political divide in the country.
Probably, but I mean, if he had paid attention during the campaign, he would have known that was not going to happen. I mean, come on. I mean, at the time, this was back when I was listening to political talk radio, and it was all Republican political talk radio. And it was clear the right was not going to work with Obama. It was absolutely clear. And the fact that he didn't see that and he didn't do what was right. And we're stuck with Obamacare, and it has a terrible legacy. And this, like, if we had gone with single payer and it had worked, there's no chance that this bill would have passed. There's no chance. But I digress. The bill, because of the fact that it's doing away with the individual mandate, it got rid of the tax penalty for not purchasing insurance. It repealed the mandate not only that individuals buy insurance, but also that large employers buy insurance. So I think it was over 50 employees. If you have over 50 employees, the Affordable Care Act required that you buy group insurance. That's no longer there. So your employer insurance, you might even lose that. And in a nutshell, that's essentially what it was. Obviously, there's more details as far as the tax cuts and what kind of income that's going to generate and all of that. But yeah, I mean that's kind of the bones of the bill, plus those amendments that were done to get it to pass.
Sounds from our perspective like a bit of a train wreck for the Republicans, to be honest, now that I think about it. I was going to say kind of a train wreck for, folks like us, like folks out on the left, but again, I'm confused about the political stance of the Republicans at the moment, because I can understand why the first iteration split the party. Because you've got a Freedom Caucus that is gung-ho on finances. You've got a moderate Republican base that's actually worried about the constituents that they represent. For instance, like they could lose their seat. So I'm really confused at why this version, which admittedly seems to be worse, was able to pass. Is there political pressure coming from the executive finally? Like, is Trump actually being able to kind of step into those political pressuring shoes? Is it pressure from inside the House itself?
A lot of the narrative that's been going into this is that, yes, A lot of Republicans realize that this is a very flawed bill, and that's being generous. But essentially, Trump looks incredibly weak. He looks like he cannot lead. His first 100 days, he got nothing done, and there's an immense amount of pressure to do something. And it just might be the wrong thing. It's not even, it's politics. Nobody wants it. Obamacare has only gotten more popular since the election, and now people are pulling it apart. They're pulling it apart sheerly for a political victory.
But it is politics that looks as if it's literally working against the political advantage of the Republicans. I would agree. Just in simple seat count, like what is their perspective come the 2018 midterm elections?
See, and that's the thing. I am confused as to why it's being pushed through. It's just terrible optics all the way around. So, for instance, back in 2010 when Obama was putting through Obamacare, they were shrieking on the right about how he was pushing it through and he was a dictator and they're not trying to respect the process and do bipartisan reform. It was just Democrats voting for it and they're pushing it through. Well, now, the Republicans did the exact same thing. They just pushed it through, only Republicans. And even worse, they did not even wait for a CBO report. There is no recent CBO report after these amendments saying what the long-term effects of this is going to be.
So what you're saying is that the Republicans have effectively voted through a bill that they don't actually know the financial outcomes of?
Yes.
Fantastic. There is no honor in politics.
None. There's none. And it's unlikely to pass the Senate. The Senate Republicans tend to be much more moderate, if you can call any Republican moderate. Sorry. I mean, I'm just thinking, like the Senate Majority Leader is Mitch McConnell. He is considered a moderate Republican. He's not. If you think about the process that's going to go through, it's probably going to be very much heavily amended. So I'm sure the Senate's going to come back with many amendments and say, well, no, we don't like this. No, we don't like that. You got to fund high-risk pools a little bit more and do all this. At the end of it, the bill might look very different. But I think the politics of it is that it is a victory for them to put it through the House. It is a victory for them to pass a piece of legislation.
Okay, so the political benefit is simply the fact that we have defeated Obamacare.
They can say, and here's the thing, if it doesn't work out, which I don't think it will, if it doesn't work out, they can still say, well, we were voted in because we said we were going to repeal Obamacare, and we stuck to our promise and we did it.
Yeah.
But the thing is, they're going to look horrible if it flames out, because they had 7 years to come up with a replacement. And if the replacement that they come up with hurts matters and makes it even worse and fails, I mean, they're toast.
Well, jumping over to the Senate then a little bit, what is the prospect of the Senate essentially, perhaps not stripping out the amendments, but, suddenly the Senate begins to add in more money, more funds into the program, or brings back certain limitations on insurance companies. When it goes back to the House, what happens then?
The Freedom Caucus won't support it. So there's going to be a political calculus that the Republicans in the Senate are going to have to go over too. So they're going to want to look unified. They're not going to want to look like, oh, Senate Republicans are scuttling what the House Republicans are doing. It's like the left hand doesn't know what the right is doing. They're going to want to be unified. So the political calculus on what they put into the bill in the Senate is definitely going to have to take into account what would pass in the House. So I don't know. It's really hard to predict at this point. It could be the case that the bill dies because the House and Senate just can't agree. Could be. But right now, the bill, as currently structured, it has zero chance of passing the Senate. Absolutely 0%. It's not going to pass without serious amendment. So we just have to wait to see how that sort of shakes out. Right now, I haven't heard or read anything as to what the Senate wants to do. It's just all I've read is that Republicans in the Senate are not on board with the bill as it is.
Well, and Republicans only have a majority of 2 in the Senate anyway.
Exactly.
So it wouldn't take too many defections to, essentially have it
right.
fail.
It's going to be very delicate. But at the same time, the political disaster of not passing it is sort of, I think, going to drive people to figure out a way to get it through, unfortunately.
One of my other questions in this is that given, we're talking about the Republicans And essentially the infighting in the Republicans, like the reason it didn't pass the first time was because you had three major kind of branches of the Republican Party trying to do different things. Where are the Democrats in all of this? Are they essentially just a non-entity? As long as they show up and mass vote against any change, they've essentially done their job. Is there anything that they can do, anything that they should be doing, anything that they've done that we're just not giving them credit for?
Well, okay. So I will give credit because the House Democrats 100% voted against the bill. So there's that. They don't support it. In the Senate, things could get a little bit more iffy. So there's a senator named Joe Manchin. He's the senator from West Virginia, and he's a Democrat in a Trump state. So one of the problems that is in the American political system is that there's not as much unity in parties. So there's not, and there's really no consequences if you go against 90% of your party's platform. So unless, because if your voters put you there, they want you there. This guy, Joe Manchin, has voted, I think it's like 90% of the time with Republicans on things that have happened since Trump's been elected. He's voted almost completely for every single one of Trump's nominees. That is somebody that I'd look at and say, there is a chance, at least, if there are some amendments done to the bill, that he'd vote with Republicans. So I think there's less chance of Democratic unity in the Senate. But the thing is, the Democratic Party has lost so much influence. I mean, it's becoming an irrelevancy. Honestly, I mean,
well, and this entire debate has been a non-entity entirely. Like, you don't hear about the Democrat. Like, all they can do essentially is get up and wave their flags and point their fingers, but that's about it. You're still not hearing the Democrat voice come through because it is Republicans fighting Republicans on this one.
The problem is that the Democrats are put in the position where they're defending Obamacare, which is not terribly popular. It's not incredibly effective. In our minds, you and I, as progressive liberals, right, we look at Obamacare and we don't like it.
Well, no, it's essentially the closest thing I've seen to a fascist policy.
Right, and we don't like it at all. It's as close as you can get to universal health care by still putting in a role for private health insurance companies.
It's mandating, almost literally taxing people, forcing people to buy on the private market. It's forced capitalism, essentially.
The problem is that Democrats have to defend this now. So mainstream Democrats like Nancy Pelosi, not Bernie Sanders. Obviously, we know what Bernie Sanders agrees with, but like people like Nancy Pelosi, they're talking about, we need to save Obamacare, and Debbie Wasserman Schultz, that troll, she is essentially saying, well, we can't start with a blank slate. We already have Obamacare. And it's like, yeah, but Obamacare sucks. Like, yeah, you can start with a blank slate. Absolutely you can. But these mainstream Democrats, essentially, they're just like, well, let's just leave things as is. Let's try to tweak and improve Obamacare. Because ultimately, they don't have the balls to say to the health insurance industry, yeah, no, thank you. We don't want private insurance anymore. And so these corporatist Democrats have nothing to do or nothing to say except, hey, Obamacare is doing okay. It's better than what it was before. Let's keep it. And so people look at that and they're like, yeah, well, my insurance premiums have gone way up. And, these Republicans are talking about all of these things, and there's death panels, which there aren't, and all this kind of stuff. But the Republicans have driven the narrative on Obamacare so effectively that people don't like it, not even realizing what it is. If you poll the individual aspects of Obamacare, they poll very highly, over 60%, most of them. And then when you poll Obamacare, it's universally people don't like it. When you poll the Affordable Care Act, people are like, oh yeah, Affordable Care Act sounds great. I saw an instance where somebody was saying, oh, Obamacare needs to go. He's like, I get my insurance through the ACA, I'm fine, but Obamacare's been a disaster. And it's like, they're the same exact thing. It just shows you to the level at which the Republicans have been so successful in their framing and narrative building of the situation. If the Democrats stay with that narrative, they're going to lose. There might be a day where when TrumpCare is so bad that people look back fondly on Obamacare and want it back. But honestly, in my opinion, what House Democrats can do, at least right now, is support H.R. 676, Medicare for All. It's a bill that was introduced by Representative John Conyers. It's a Medicare for All bill. It expands Medicare to cover everybody in a single-payer system, and that would be it. So I think originally it had like 80 supporters, 80 people who would co-sponsor the bill. There's been a huge push lately. I know that a lot of the radio stations I listen to, progressive radio stations I listen to, have been urging their people, their listeners, to call their representatives and say, hey, if you don't vote for this, I'm not voting for you. And I'm going to tell every single person I know not to vote for you. I will vote for a Republican before I vote for you. And no, I'm serious. And over the last few weeks, the people who have co-sponsored the bill has jumped from 80 to over 100. So it is working. So the pressure that people are putting on is working. So I guess what I would say is that the Republicans and the Democrats are not, they're not so different that people say one is better than the other. And we see that when Republicans get into power, they do the American Health Care Act, which is, you and I can both agree, doesn't look like it's going to be successful at all. No,
not at all. Neither in the legislative houses nor in the public.
And there's no real substantive difference that the Democrats are offering. If they were to, en masse, just say, hey, let's do Medicare for all. Here it is. We have it right here. Look how much this would save us. Like, look what this would save us in tax dollars. Look at it would save you. Let's do this. There's just nothing. There's nothing bold. There's nothing different. There's nothing. There's no true leadership right now on the Democratic side. On the liberal side, there's just no true leadership. It's just corporatist Democrats who are doing what they have to do to get by and get reelected, and they're saying the obligatory things about Republicans, and they're voting against these awful, awful bills. But at the end of the day, if you're not going to fight back and really change things, they can't be doing any worse than they are right now. Why not be populist? Why not actually try to be radical and do something that polls incredibly highly? I think it's like 60% of people in the United States now want Medicare for all. It's not some, and even more than 50% of Republicans support universal health care. So it's a winning issue for them, but they just don't understand how to drive the narrative. You know, like it's insane to me how effective the Republicans are at it. So the death panels in Obamacare, that there will be panels that literally decide if you live or die. A lie. How many people, if you poll Republicans now, I'm sure a majority of people believe that that's the case. When you talk about the estate tax, right? This is outside of what we're talking about, but just an example of narrative building. The estate tax. Essentially what that is if you die and you have an estate that's worth over $4.5 million, the amount over $4.5 million is subject to a tax. Okay? It's called the estate tax. Who better to tax in society than rich dead people, right? Your kids still get a huge chunk of money. You get $4.5 million plus whatever is above that after taxes. But what Republicans have framed this as is the death tax. And Joe Schmo, who's a union guy working for, $20 an hour, looks at this and says, I'm going to die someday. Like, I don't want to pay a death tax. When really it's like that guy would never in a million years have to pay the estate tax. Everything he has is going to go to his kids tax-free. Literally, it's like the top 0.1% or 0.2% of people who actually will end up paying the estate tax in the United States. Yet it's the death tax, and it is referred to as the death tax. And people are like, oh, I'm going to die. I don't want that. Like, it sounds terrible. You're taxing people for dying. It's like this person, you're not taking money from a living individual. You're taking this from a dead person. And their kids still get a shit ton of money. But the narrative building, like the Republicans are so good at it because they just lie their asses off. And the Democrats, they don't know how to fight against it. And it's so frustrating. And
you think that, they would have a number of good things working for them as well. Like the Obama administration was filled with, positive progressive lines like, increases in the minimum wage, like actual health insurance for people that never afforded it before. Mind you, I don't think cash for clunkers was that impressive, but still. Or even the idea of wanting to improve our environment, decrease pollutants in the environment. Like, these are all very positive lines, and they can't actually, manifest any single brand or positive narrative out of it.
Right. I mean, talking about minimum wage stuff, Obama, essentially, through an executive order, he made it so that he doubled the income bracket that you could get mandatory overtime. So I think it went from $23,000 to like $46,000. So if you were making $44,000, you are mandatorily paid overtime for anything you work over 40 hours. So it's like, he did these things that are massively popular. Where was he on all the Sunday shows? Where was he traipsing around the country on every show saying, look what I did? Like, the Republicans will shove everything that they do right in your face and say, look how good we are. And the Democrats just have not mastered that at all. Like, they do these good things, and it's just like, oh yeah, we did this great thing, whatever. But it's not like, look at all of our accomplishments. I mean, look at Trump. Like, he takes credit for stuff that happened before he got into office. Like, he'll take credit for big companies keeping employees. He's like, I negotiated that. Like, I made them do it. And the deal was struck in, like, October last year. Like, it had nothing to do with Trump. But he's still taking credit for it. And so I talk to my family, right? And they say, oh, yeah, Trump's great. Like, he's keeping jobs in the United States, and he's making all these deals with these companies to keep their jobs there. And it's like, there's just no filter there. Like, people don't filter the information that's coming in, and they just believe whatever he's saying. It's crazy. It's insane to me. The number one thing I heard from Republicans who were debating the bill today was, we're bringing this back to the American people. We're stopping failed Obamacare. We're bringing you choice. We're bringing you choice. Like, you should treat, healthcare like you're going to Denny's or Subway. Oh, look at all these choices I have on the menu, right?
Exactly. It's market language again.
Right. And it's like, yeah, but you realize, so you have choice. You have option A, B, and C. A costs the most, B costs the least. And you're like, oh, well, I'll go for whatever costs least because I can afford it. And then you get pregnant or something, and you've probably never had to deal with this, Adam, but when you're looking through your health insurance policy, it's almost impossible to truly understand what's covered and how it's covered and what gets paid where. It's very complicated. So most of the time, people just go with the option that is cheapest. And then they get pregnant, and it's like, well, we don't cover prenatal care. We don't cover postnatal care. Oh, your kid doesn't know how to breastfeed? Too bad. Postnatal care is not covered. That's going to be $350 per visit to a lactation consultant. And then it's like, you're paying less upfront, but the care still costs just as much. And you are just as likely as anybody else to have to need that care. This is why we need a single-payer system, because you have these for-profit insurance companies and systems like Obamacare, which are not good, systems like the American Health Care Act, just bend over backwards to include and shove these for-profit insurance companies into an industry that, like, does not need them. They are an unnecessary for-profit middleman. I'm giving my money to you to give to the guy who's giving me care. And then you're negotiating with him on the other end so that you make a profit off of me. Why not just cut that out? I would gladly pay what I pay in a premium for taxes, even if my health insurance costs out of pocket in taxes didn't go down. Knowing that it was paying for an effective, efficient, single-payer system, I wouldn't mind. I'd want that. I don't know. I'm off my soapbox now. I'm just so disappointed with this today. Just so disappointed.
Well, I can only speak to the benefits of a single-payer system. It really has been beneficial. Like what I've said, the upfront tax payment on our end, my family in particular, has been fairly low, but the outcome, the bang for tax buck is very high with a single-payer system, so I can only speak highly of it. Even with the ridiculous stories that you do hear coming out of, the UK regarding the NHS and the crisis that it's in. The crises that you see coming out of the UK are minimal relative to the amount of people that are literally aren't covered by insurance in the States. So where perhaps the NHS might be in crisis because there aren't enough beds in the emergency room in the States under that particular system, particularly pre-Obama, and perhaps where we're heading back to, it's more, well, there aren't enough people that can afford to get the healthcare that they need to even fill the beds in the emergency room. So it's, even with the problem, there are problems with the single-payer system and there are problems with the NHS, but...
In the UK, does anybody have to choose between going to the doctor or being able to pay your bills?
No.
Yeah. There you go.
You can always go to the doctor. Yeah.
That's all I need to know. The people who are against single payer talk about how, you'd have to ration care and everything because you wouldn't have enough resources or something along those lines. But my argument to that is that we are rationing care. It's just not based off of need. It's based off of how much money you have. If you can afford it, we'll give you care. And if there's a lot of people who can afford it, then you're going to have to wait, essentially. If you need it, and this is the most insidious thing about this bill, is that the people who need care the most, who need insurance the most, who aren't millionaires and making tons of money that they could potentially pay this out of pocket, they're the ones that are going to be hurt. They're the ones that are going to have to not have insurance and not be able to pay to go to the doctor and not be able to afford it. The fundamental problem with applying these market forces to healthcare is this is where you're going to end up. You're going to end up with a system where you get what you pay for, and if you can't pay, you don't get anything. And that's just sad. I think that it's a grossly negligent thing for the government not to supply such a basic right as healthcare. And unfortunately, in the States, we're moving further and further away from that.
Well, on that happy note, thank you for listening to the Commoners Podcast. Remember that you can follow us on Twitter at CommonersPod. You can also subscribe to us on YouTube, where these episodes are also uploaded. You can catch the Commoners Podcast every second Monday, and the political animals are kind of still in a hiatus, but hopefully you've caught the one that had dropped into your feed there on Friday as we discuss the French elections again. So, again, thank you for listening, and as always, stay informed.